Hello. This is my my Capstone research project on sex education in the United States and the implications for STI transmission. It is done by me. This is Maggie, by the way. Um, my hypothesis for this research project is that based on existing evidence about lowered teen pregnancy rates after the implementation of sex education programs, that STI transmission would decrease in general. And then there are further implications for opt-in or opt-out states. The purpose of my research project is to determine how opt-in and opt-out state-regulated sex education policies, as well as abstinence only or comprehensive sex education, affects transmission of sexually transmitted infections among college-age people. To kind of explain a little bit of about the research topic, opt-in and opt-out are policy types, and then opt-in adds an additional barrier to accessing education. Then abstinence only and comprehensive sex education are the curriculum that is taught in these courses. And then different things are included or excluded based on these factors. And then research does show that sex education reduces unwanted pregnancies, but STIs continue to increase in the country. And so we need to find solutions that help prevent transmission. Some of my findings from my research are that when young people are taught about contraception or given information on how to use it or to get it and other medically accurate information regarding sex and STIs, they use it. So that shows that when we give people accurate information in sex education courses, that they do implement that in real life situations, which is really strong evidence to have sex education and to have people in those classrooms. Additionally, research shows that comprehensive sex education can improve condom use. Again, CSE or comprehensive sex education is the type of curriculum. And as it indicates, it is comprehensive. It has a lot of information that abstinence only leaves out. And then all in all, sex education and sexual health services are integral in reducing STI prevalence. And I think the emphasis on sexual health services is really important there, because abstinence only usually does not teach people where to get these services and what is needed and all of those kind of things. With all of this in mind, I think my hypothesis was correct that different types of sex education, specifically the implementation of opt-out programs that are comprehensive, will dramatically decrease STI infections among people. And I'm going to talk about my knowledge product and kind of show how these policies directly affect the health of people in the country. So the first page is an infographic, and the second page is more of a policy brief. The first part is what you should know about sexually transmitted infections, and it has 3 parts. These 3 parts can kind of be summarized with the transmission part, the kind of why it matters for you, and then prevention and treatment. And then the second part is a policy brief. It discusses some more of the core components of my research question. This map at the top shows the state's policy type, whether it's opt-in, opt-out, both policies or no policies. And then moving down, we have these are just gonorrhea cases, and these are CDC maps. We have 2011 and 2020. So we can see that they are increasing. The darker color indicates the highest amount of cases. And we can see that in 2011, it was mainly Mississippi that has really high STI prevalence, specifically in gonorrhea. And then in 2020, they are increasing pretty much everywhere. And then this map shows just the STI prevalence across the country and incorporates all of the STIs. So it gives a little bit more of a full picture. And so some of the dates are not perfect in these graphs, but I think it is a great visual representation of the cases, especially in 2011, and on the just overall, Mississippi is having the highest rates of STIs in the country, and they are an opt-in state. So I think that really speaks to the barriers to education that people are having in the state of Mississippi. And I think also it is important to note that in 2020, during the COVID-19 pandemic, a lot of the health education and sex education courses were completely cut out of the curriculum for students due to lack of funding. And I think that is also really leading to these increases. And both of these are geared towards college age people. And I think that the different actionable steps on the infographic and the call to action on the policy brief really make my things make sense. I think it's really important for people to be able to advocate for their health. And because the government is getting involved in changing these policies and what is allowed and what is not allowed to be taught, I think having a call to action on a policy brief is a great use of space and a great use of time for college age people. And then I think also just providing basic educational tools of what they can do, meaning using barrier protection, getting the HPV vaccine, and then also getting tested regularly are great steps that college age people can take to reduce the prevalence of STIs in their communities. That is all I have. Thank you for listening. My references are right here. And if you have any questions, please let me know.